At South Texas Health System, the health of you and your family has always been our top priority. It inspires us to be among the nation's healthcare leaders. We're proud to be home to the Valley's first and only freestanding children's hospital, the state's first dedicated heart hospital, the first behavioral health facility with private inpatient treatment, and Hidalgo County's first Level 2 trauma center. And we continue to transform healthcare, investing in advanced technologies and innovations to help you heal faster. It's that commitment to your health that has allowed South Texas Health System to build a reputation for excellence across 11 facilities, earning recognition for patient safety, cardiac care, robotic surgery, women's health, stroke care, and more. With our integrated network of nationally recognized facilities, freestanding emergency departments, physician practices, and outpatient centers, we are where you are, providing compassionate care and comprehensive services for you and your family. Greetings and welcome to our latest Let's Talk Your Health webinar. I'm Tom Castañeda, the System Director of Marketing and Public Relations for South Texas Health System. On behalf of STHS, thank you for joining us. Health education plays a crucial role in helping you lead a longer and healthier life by providing the knowledge, skills, and motivation to help you adopt healthy behaviors, which can lead to increased life expectancy and improved quality of life. But that's not all. Education can help prevent, delay, and manage health conditions. So to help you prioritize your health, South Texas Health System hosts these monthly Let's Talk Your Health webinars. Through education on common health conditions and ways to protect your health, we hope you'll be able to improve your overall well-being. Now, in this installment, we'll be discussing sepsis, a life-threatening condition that occurs when the body's immune system overreacts to an infection. Sepsis affects nearly 2 million Americans each year per the CDC, but it can affect anyone regardless of age or health status. It occurs when an existing illness like pneumonia, a urinary tract infection, or gastrointestinal infection activates a chain reaction throughout the body, leading to organ dysfunction. Sepsis can progress to fatal organ failure or septic shock in a matter of hours, even minutes, without proper treatment. Unfortunately, sepsis and the dangers associated with the life-threatening medical emergency remain widely misunderstood. So to learn more about sepsis and how to prevent it, we're joined by Dr. Iris Frausto, a physician in training with the STHS GME Consortium's Emergency Medicine Residency Program. Thank you, Dr. Frausto, for joining us.
Thank you.
Now, you have joined us this year as a resident, one of our first official emergency medicine residents. What has the experience been like so far?
It's been great. It's so many different things to learn. Currently, I'm in my OB/GYN rotation, so I've seen a lot of pregnancies. I delivered 5 births already. I helped out with multiple procedures as well. So it's been a great learning experience. And
you're originally from South Texas. You're from Eagle Pass, so you're down in an area that's close to home, right?
Exactly, yeah. And that was the whole purpose. I really wanted to come back and really build my career to help out my people, basically.
Mm-hmm. Now let's talk a little bit about sepsis, because unfortunately it's something that we don't really talk about a lot, right? According to studies by Sepsis Alliance, about 87% of Americans can't recognize the risk factors for sepsis, and about 8 in 10 Americans don't know basically the symptoms of sepsis. Is this something that you find in the hospital setting? You've been here since July. Mm-hmm. You said you've seen, about 10 cases?
You're right. So I've seen about 10 cases, and usually when they come into the ER, they're already at the borderline from a sepsis to septic shock, and sometimes they're even like let's just say in a very dire need for medical management. Yeah,
immediate medical attention.
Exactly.
And with that, is it the conversations that you're able to have with loved ones or with the patient themselves about, oh, I had an infection, I thought I was okay, or I wasn't treating it, I thought I'd get over it? What are the reasons that you hear for them not seeking treatment sooner?
So usually the majority of the people, they already have some type of infection, whether it's a pneumonia, whether it could be like a cellulitis from a wound, that like a chronic wound, let's say, or it can be already an established UTI. And sometimes they'll already be on antibiotics, and sometimes those antibiotics are helping, but that infection kind of overruns the body, and then you have that over immune response from the body that kind of throws everything into like a wacky state.
Yeah.
So it's harder. Disarray. Exactly. So it's harder for that patient to be able to compensate for those derangements, and then you progress to sepsis. And some people take a little longer to get into sepsis. Some people, it's just so fast. So there's a lot of contributing factors as well.
And the bottom line is that if you have an infection, whether you're dealing with a UTI, pneumonia, whatever it may be, you really need to be seeing a doctor and getting proper treatment as soon as possible, right?
Correct. Yes.
And this is one of those scary things that you just don't think about. I know I only started working in the healthcare setting about 5 years. Before that, I'd never really heard about sepsis. I mean, I'd heard about it, but I didn't really know about it until you hear the code being called at the hospital, and you realize that it is
happens very
more
often.
Serious than you imagine.
Yes.
And education obviously is really important. It's key when it comes to preventing illness and preventing any sort of tragedy. And you have put together a great presentation for us, right?
Yes, of course.
All right, let's get started.
Okay, so let's talk about sepsis. So sepsis is sometimes called the body's overreaction to an infection. It can rapidly progress without treatment, and it can be fatal. So this is me, Dr. Iris Frausto. I'm an emergency medicine resident in PGY1, so that's my first year of training. So what is sepsis? So sepsis is defined by the Third International Consensus definitions for sepsis and septic shock. It is a life-threatening organ dysfunction caused by a dysregulated host response to infection. So this sepsis -3, that is our most current definition of sepsis. And it's definitely, sepsis is the body's overreaction to the infection that can progress rapidly without treatment and can be fatal. So sepsis is a medical emergency. It can affect anyone, whether you're young, elderly, healthy, or sick. It strikes fast and at anybody. So in the US, there's roughly about 1.7 million adults who are diagnosed annually. And those are just adults. So you don't have the children in there, babies. So it is a high morbidity and high mortality. So what that means is a high risk of death and disability. There's about 1 in 3 hospital deaths that are related to sepsis, and then 30 to 40% is caused by septic shock. It's the leading cause of ICU admissions worldwide. So what causes sepsis? So the pathophysiology, our medical term of how sepsis progresses from a simple infection that can either be bacterial, viral, or fungal in origin. So it can be virtually anywhere. You can have a bacterial infection in the skin, you can have a pneumonia, you can have a viral infection, also like an upper respiratory infection or any fungal infections. So these simple infections overrides the immune cells and the body's immune system. So these immune cells begin releasing a lot of cytokines, which is our, let's just say like missiles and, bullets, type of things that our immune cells release into the vascular system. So it doesn't necessarily target it directly, but it causes a widespread total body response. So when it becomes dysregulated, this immune response leads to a cytokine storm. So it's just a massive release of these cytokines that causes dysfunction throughout the body. It leads endothelial dysfunction. So what that means, all those things attack the vascular system, so your veins, your arteries, and it makes them become leaky. So the more leaky they become, it causes the vessels to dilate. So it becomes, instead of a tight water hose, now it's a leaky water, like plastic bag. So with that, all your like fluid within the blood, like the plasma, comes out, causes edema, it leads to low blood pressure, and then it causes the body not being able to adequately perfuse and provide nutrition and oxygen to all your cells. And within those cells, your mitochondria, and you can't form the energy that your body needs to sustain all your activities. So with that, it leads to organ failure, and then organ failure leads us to a massive inability to clot, and then that can also lead to too much clotting. So it just causes a very huge disarray in the body's immune response. So there's 3 stages of sepsis. You have sepsis, severe sepsis, which is more of a historical term. It's based on our sepsis 2 definition, but we still use it today. Septic shock. So you have your simple infection that leads to sepsis, that causes severe sepsis, and then septic shock. And then again, sepsis is the severe sepsis was eliminated within the definition of sepsis 3. And now it's just sepsis, organ dysfunction, and septic shock, which is sepsis with circulatory and metabolic failure. So meaning you're not able to circulate all your blood and plasma and nutrients properly, causing the cells to just fail and not able to function. So in a deeper sense, so sepsis, again, is a life-threatening organ dysfunction caused by a dysregulated host response to an infection. Usually we diagnose this clinically. So if you have a patient come in and they have what we kind of check off, whether it be the SIRS criteria, we can use SOFA or QSOFA, which is a guideline of how we can determine whether this patient meets our sepsis criteria. And that's how we build our evidence before we even take your blood samples and all those things. So we have a suspected or confirmed infection plus the evidence of the organ dysfunction, and then we start treating you for sepsis, because the earlier the treatment, the higher probability you are to survive and fight the infection, as well as minimizing the long-term damage to the body. Okay, so examples of organ dysfunction: you can have low blood pressure, you can have confusion, you might even stop having the ability to urinate, you can have also stop the ability to form clots because your platelets start depleting and your liver can start failing. So there's a whole bunch of things that can occur. So severe sepsis, you have, which is our historical term, defines it as sepsis plus organ dysfunction, hypoperfusion, or hypotension, meaning that there's an infection that's overran the body's immune system plus organ dysfunction. So now you have 2 or more organs that are not functioning the way they should be, plus the low perfusion, where your blood isn't being directed to all your necessary organs and leads to low blood pressure. The infection and immune overreaction start to cause organ problems, and the body is no longer able to keep up with the fighting of the infection. So now you have the most devastating part of the sepsis trilogy. So septic shock, you have your sepsis is a subset of sepsis where circulatory and cellular metabolic abnormalities are profound enough to substantially increase mortality. So basically it's just saying now you have the sepsis so far in advance that your body's not able to circulate your blood, circulate your nutrients, circulate the oxygen, take out those bad metabolites out of the body, whether it's through feces or through urination, and then you're not able to function properly at the cellular level. So it's profound enough that it can cause death. Our diagnostic criteria for septic shock is persistent hypotension, which is persistent low blood pressure that requires vasopressors. So this is medication to help in maintain your blood pressure above 65 millimeters per mercury. And there's a serum lactate level of more than 2. And these are labs that we take. So despite all this and adequate fluid resuscitation, meaning we give you fluids with the IV bag to help bring up your blood pressure. So clinically, it has a high mortality, about 40%, requiring aggressive resuscitation, vasopressors, which norepinephrine is our first medication of choice to help bring up that blood pressure, and ICU level care. So this stage is life-threatening, require the ICU care with medications and machines to support their body. Even ventilators. Sometimes the sepsis, whether it could be a pneumonia, can overrun the body and you're not able to breathe on your own, so we provide that assistance with the vent. Blood pressure is dangerously low despite the IV fluids requiring medication, and the risk of organ failure is great due to the oxygen and nutrients that are not able to reach the organs. So signs of sepsis. So first you start off with an infection, right? And then we get our fevers, we take our Motrin and our Tylenol, and we start to try and bring those fevers down. So when you have a fever of 38 degrees Celsius, or that's about 102 degrees Fahrenheit. Or you can be hypothermic, which is less than 36 degrees Celsius, which would be about less than 90, I want to say 98 to 97.5 degrees Fahrenheit. So you can either have a very high fever or a very low body temperature. The infection, so you have an evidence of infection, whether it be a cough, painful urination from a UTI, a wound redness, and there's just anything. So you can have like diarrhea from a gastroenteritis that just never goes away, and cellulitis from the skin, or just, from a cut, then it kind of progresses and takes over. So mental status changes, you can have confusion, drowsiness, agitation, or somnolence. And somnolence would be when the person is too sleepy and they're not able to stay awake. So if you have any of these, definitely get to the hospital right away. And when you're extremely ill, you have a tachycardia, which is a heartbeat of about 100 to 120, but it could be a lot higher. You can have tachypnea, which is a respiratory rate of greater than 22 breaths per minute. So if you're breathing way too fast, out of the normal, or essentially people come in saying that they feel like you might die, like they might be dying. So signs and symptoms of septic shock. You have general sepsis features are still present in addition to shock-specific features. So in addition to what we just went over, now you have persistent hypotension despite IV fluids that requires vasopressors, which is our medication to help maintain your blood pressure within normal limits to sustain your life, and narrow pulse pressures. So you have your poor tissue perfusion, which is evidenced by elevated lactate, which is part of our labs that we draw when we take your blood, just to be able to see how you're doing. Cool mottled clammy skin would be like you're cold to touch. It's kind of like reddish, purplish, still with your skin tone, just all kind of mixed together. And clammy skin, so you're kind of like sweating, but like a cold sweat. Delayed capillary refill, and oliguria and anuria. So you would have either no urine output or very, very little urine output. Organ dysfunction evidenced by hypoxia, ARDS, rising creatinine, oliguria, jaundice, increased bilirubin, and thrombocytopenia with DIC. So those are all your signs and symptoms of septic shock. Management. So initially, when we start treating you, we like to call your sepsis alert as soon as possible so we can start all these resuscitative measures to help you fight the infection. So when you come in, we call our sepsis code. We measure lactate, so we go in and take your blood, we take blood cultures, we get your lactate level, and if it's elevated, we just have to recheck it to make sure. But as soon as we get your blood cultures, whether or not we know what kind of infection it is, we start you on broad spectrum antibiotics. So these are antibiotics that are not specific to a type of bacteria or fungus or what you may have, but it covers a lot so that we can like throw in, like, let's say like a bomb to treat the infection so that you're able to sustain and, keep you without approaching that devastating effect, which could be death. So the broad spectrum antibiotics are usually given within an hour of a sepsis alert. We start you on IV fluid, and this is our calculation of how much fluid to give you, which is our 30 milliliters per kilogram based on your body weight. IV crystalloid fluids for hypotension, and a lactate of greater or equal to 4. And then if that doesn't work, we go to our medications, and our first line medication would be norepi to try and keep your blood pressure, which is our mean arterial pressure, of greater than 65 if the fluids are not helping. And then ongoing care, once we stabilize you in the emergency department, we would admit you into the ICU, and we get our source control. So whether it be surgery to remove the source of infection, if it's an abscess or some type of thing that's causing that infection within your body, drainage, if it's a wound or maybe another abscess that's more superficial, we can drain that out of the way. If it's like a pleural effusion from a pneumonia, we can also start draining that and start giving you antibiotics. Or it can be caused by urinary catheters, IV catheters, and if that's the source of infection, then we have to take those out, replace them, and give you new ones. But maybe not use the same site. So, and then hemodynamic support. So of course, we're going to give you your vasopressors, fluids guided by our dynamic measures. So we are continuously checking your blood pressure to make sure we don't fluid overload you and maintain you in that nice normal range. Ventilatory support, if you have acute respiratory distress syndrome, if the pneumonia is too severe and you're unable to breathe on your own, we can put you on this ventilator to help breathe for you or help you breathe essentially. And any adjuncts would be stress dose steroids, hydrocortisone if you're in refractory shock. So complications of sepsis. You can have multi-organ failure, and it can be triggered by widespread inflammatory responses leading to a reduced blood flow and organ damage. So essentially, it can affect any organ of your body. So in your respiratory system, it can affect your lungs, which can cause acute respiratory failure, or ARDS, which is acute respiratory distress syndrome, which is essentially all your lungs are not functioning well. In your renal system, so it's going to affect the kidneys, and it could cause acute kidney injury or failure. Your liver can lead to liver failure. Your central nervous system, of course, you can have your altered mental status. You can have cognitive impairment where you're not able to comprehend or be able to articulate your needs and wants. Gastrointestinal system also, it can cause stress ulcerations in your stomach, because if you're in this state and you're receiving IV fluids, then you're not able to eat on your own. So we have to give you nutrition through the IV as well, which can lead to stress response in your stomach, leading to these ulcers. Diverticulitis can also be a cause of sepsis. If it's so inflamed, the diverticula can cause the bowel to perforate, leading to feces spilling into the abdominal cavity. Disseminated intravascular coagulation is DIC, and it's characterized by low platelet counts and increased risk of bleeding. You can also have critical illness myopathy and polyneuropathy, which is just a condition characterized by generalized symmetric weakness and muscle wasting affecting critical ill patients. So if you're in the ICU for several days, several weeks, if you're not moving about, your muscles start getting weak and your nerves might start being affected as well, leading to both muscle damage and nerve damage. There's also a post-sepsis syndrome, which can occur after we essentially get you better. It is a collection of long-term health issues that affects half of sepsis survivors, that include long-term problems with the body, mind, and mood after recovery. So physically, you can have fatigue, weakness, poor sleep, and shortness of breath and pain. Cognitively, you can have memory loss, trouble focusing, or brain fog. Psychologically, you can have anxiety, depressions, and even PTSD. Medically, you are also at a higher risk of infections and rehospitalization and death. Management would be rehab, whether it's physical rehab, a mental health care rehab. You would need close follow-up and infection prevention. Surviving sepsis doesn't mean full recovery, but it may require long-term support. So prognosis. The mortality rates for sepsis is about 20 to 10%. Septic shock is a little bit higher, so 30 to 50%, due to higher, and even higher if there's multi-organ failure or delayed treatment. So that's why it's important to seek medical help as soon as possible. Prognostic factors, or factors affecting what your survivability, and would be advanced ages, also whether the person is too young as well. Multiple comorbidities, so if you have multiple disease/disorders like diabetes, hypertension, cardiovascular disease, there's the more things you have that you're taking medication for because of these diseases, the more it can affect your survivability and your mortality rates. Also, the development of MODS, which is the multi-organ dysfunction syndrome, Long-term outcomes, you have high risk of death in the year following hospitalization, high risk of recurrent infections and hospital readmissions. We have your post-sepsis syndrome, which is the fatigue, muscle weakness, cognitive impairment, psychological issues. And then some patients never regain their baseline independence, whether you have your older individual coming in for a pneumonia, they go into sepsis, maybe cognitively they're not as sharp as they used to, maybe they're also come out a lot weaker, so you're never at your baseline independence before the sepsis event occurred. This is especially with our elderly patients. So like we said, early recognition and aggressive early therapy and medical treatment like antibiotics, fluids, and source control is the single most important factor in improving the prognosis. And the mortality drops significantly when sepsis management 1 hour bundle per surviving sepsis campaign is completed within the first 3 to 6 hours. So when to see your doctor. You have your sepsis red flags. So if you have an infection, you want to be on top of the way it's progressing. So definitely seek medical help immediately if you or a loved one has an infection and develops any of the following. So whether your fever gets out of control and it's 102 and above, or maybe now your normal body temperature is starting to drop too low, you have a rapid heartbeat, or you start breathing too fast, confusion, dizziness, difficulty staying awake, and your blood pressure starts to drop low. So that can be felt as the patient is feeling faint or lightheadedness, even dizziness. When you have trouble breathing, also severe pain or discomfort, worse than expected, and any skin changes, such as mottled skin appearance, which is kind of that purplish, reddish, like lace type of looking pattern on your skin, cold, clammy, sweaty, and a new rash that you haven't had this rash within the entirety of your infection. So sepsis prevention tips and strategies. So the number one prevention infection is stay up to date with vaccines. So it's very important to stay up to date with your flu vaccine seasonally, your COVID-19 vaccine. For our elder individuals, you have your pneumonia, shingles. For children, your childhood vaccination, so it's important to stay with those to stay up to date. Tetanus for those who have any wounds that are caused by, let's say, a rusty nail, or out in the dirt where it's pretty significantly dirty, you might want to get a tetanus shot if you haven't had one within the last 10 years. Wound care, so if you have any wounds, lacerations, cuts on your skin, or let's say if you're diabetic, you have little cuts forming, you want to make sure you stay on top of all those wounds, keep them clean, keep them covered, make sure you seek medical professional if it starts becoming red. Maybe it starts off, let's say, at the tip of your finger, and the redness starts spreading upwards towards your arm. That's a sign of, a red flag for sepsis. If there's pus, or if the pain is also spreading. Good hygiene. So you definitely want to wash your hands often, avoid sharing personal items, manage chronic health conditions. So control your diabetes, your chronic obstructive pulmonary disease like emphysema or bronchitis. Asthma can also be part of it. Kidney disease, heart failure, and take all your prescribed medications regularly. So that's a big one for a lot of people. We need to be able to take our medications as they're indicated by your doctors, so that we don't miss and become not controlled with all these diseases. Early recognition and action. So don't ignore UTI symptoms. If your urine is cloudy, if you start having an increase in urgency, you're like that need to go to the bathroom, if it becomes too frequent, if you're having pain like burning while you urinate, then that could be a symptom that you have a UTI. Watch for lung infections. So definitely cough, fever, shortness of breath. If you're having too much sputum and phlegm production, and all of a sudden you can't move that chest congestion out, definitely we don't want it to progress into a pneumonia. Seek care for any skin infection, so increasing redness, swelling, or pus. Hospital and healthcare setting, ask your providers about infection control. They should be washing your hands using the Sani gel. Also check the IV lines and tubings and make sure that everything's being kept clean. Limit unnecessary catheter or IV line use as well. Helps prevent sepsis.
That has all been extremely helpful information, especially with a condition like sepsis, a medical emergency that we don't really know a lot about in this community, I think. Once again, we had talked about the numbers. 1.7 million Americans get sepsis each year. What we didn't talk about is that at least 350,000 people in the U.S. die from sepsis each year. Mm-hmm. It is the leading cause of death in U.S. hospitals, with as many as half of all patients who die in the hospital having sepsis per the CDC. So this is something that we unfortunately are seeing. They're arriving at the hospital in a critical state in many instances, as you had mentioned, right?
Yes. So sometimes people don't recognize the severity of their infection, and sometimes these people come in already in sepsis or maybe even in septic shock. So definitely I've had a lot of people as well, because while I was a paramedic too, they call us and they have a high fever, like 102 to 104. They haven't been able to control it with your Tylenol or Motrin. They're not able to drink water, not able to keep fluids down, not able to eat properly either. So they're already a lot weaker, they're confused. They're also unable to, essentially, they're not who they are anymore. Mm-hmm. So the quicker we are to get that medical management and treatment, like the better outcome that they have leaving the hospital.
And this is something that I found interesting. Sepsis is increasing at a rate of 10% each year in the U.S., according to the CDC, which means that, I mean, we're seeing more cases of it, and the education may not be there, the awareness to avoid the seriousness of this medical emergency. Mm-hmm. Now tell me, in most cases, in about 80% of cases, sepsis begins outside of the hospital. So once you're in the hospital setting, that means you most likely came into the hospital with sepsis.
Most likely.
Is what we find, right?
Yes. So I mean, are also instances where you're in the hospital getting this infection treated, and it just kind of already at that path where it's overwhelming the body despite our medical management. But as soon as we recognize it also as medical professionals, the easier it is to treat the infection, to get a hold of the person and their chances of recovery as well. Yeah, but 80% coming into the hospital. It's a lot.
Which means you had it before you came in. So
exactly.
That's a large number. And when we talk about the 3 stages, so you have sepsis, severe sepsis, and septic shock. What is the percentage that you think you see more of in the hospital setting? Is it the severe to septic shock?
I think more or less it's, I want to say maybe like a 50-50. You can either be in sepsis or you can have it in like severe sepsis, but definitely there's a good amount of people that are already at the borderline of the severe sepsis to septic shock. Mm-hmm. Like I said, the population doesn't really, what is it called? They don't see that they're already too sick.
They don't recognize right away.
So they don't recognize it right away. And they kind of just keep prolonging their hospital visit until the family member, or they're not acting right. They end up calling the ambulance to come take them to the hospital. So they're at that border where it's either severe sepsis or in septic shock. Yeah.
It's one of those things where you have to remember, if you see something, say something.
Exactly.
If you notice something isn't right, something doesn't feel right, you really need to go and talk to a professional about it.
Yeah, and it's always maybe a little easier to be like, okay, well, I don't feel good, maybe I should go to the doctor and get checked out. Whether it be your family primary care physician, you can go to the urgent care, or even the hospital, right? So it's better to get checked out to make sure that this infection hasn't progressed so much that you're not going to be able to leave the hospital, essentially.
Now, when we talked about the causes of sepsis, so bacterial infections are one of the most common causes, right? But it can also be a fungal, a parasitic, or a viral infection, right?
Exactly.
So it's just any type of infection. So you really have to be careful. It's not like, okay, this one is viral, I'm good.
Exactly.
It can still lead to
So
sepsis.
Usually, like in the flu with influenza, you can have your respiratory infection, which is caused by a virus. But sometimes because that virus can weaken the lung and it's still trying to fight the infection, now a bacteria came in. So that bacteria is superseding as well in conjunction with the viral. So now you have the bacteria and the viral causing the infection. So now the body can either release a whole bunch of those fighting cytokines to help fight the infection, and then all of a sudden it causes that cytokine storm, and now your body's unable to compensate for fighting both infections at the same time.
And when we talked about the different types of infection, so the respiratory system, so the lungs, so you talked about pneumonia, and pneumonia is something that we hear a lot in the elderly population.
Correct.
We get flu, we get influenza, but if you're not taking care of it, it can progress to bronchitis, to pneumonia. So it's really important to get that flu shot. I know this is flu season. I got our email from work that said flu shots are in, get your flu shot. So, but it's something that it's worth considering right now, making sure you're caught up on any vaccine that's going to help you, the shingles, pneumonia, flu shot.
Yeah, any vaccines that help prevent the infection, definitely you're already winning, right? And also there's a pneumococcal vaccine as well for our elderly. So it's good to get your pneumococcal vaccine, which is the bacterial type of vaccine for that type of pneumonia, and then your flu. So it's
and then a urinary tract infection. So we hear about those often, and you think, oh, you just take the antibiotics and you're good. But if you're not taking care of a UTI, that could lead to sepsis.
Yes, definitely. So we do see a lot of patients that come in who have been treated for UTI. They've been taking their antibiotics, and then sometimes we have some patients that are like, oh, I stopped having symptoms, it stopped hurting. So they'll stop taking their antibiotics early. They don't complete the course. So it's very important to complete the course of antibiotics. So if the doctor tells you, okay, you're gonna have to take a pill twice a day, 12 hours apart for 7 days, you need to take that pill for 7 days.
Yeah, because you start feeling better and you think, I'm okay, but you need to finish the dose because that's why it was prescribed for 7 days.
Yes, so exactly. So you want to make sure that you take the infection out with the length of the antibiotics that they gave you for. And also you don't want to have that bacteria become resistant to the antibiotic. So now you would have to need stronger antibiotics. And then usually stronger antibiotics are maybe not the best. It is good to fight the infection, but it could definitely take a toll on the body a little bit more. So it's better to take your antibiotics, as they say, as prescribed by the doctor, for the amount of time that you have to take it to fight that infection.
And then gastrointestinal system, so that's appendicitis, so the appendix, bowel problems, the gallbladder or liver infections. We hear a lot about gallbladder disease being on the rise here in the Rio Grande Valley. So the gallbladder, not only are you at risk of losing your gallbladder, but if you're not taking care of it, and then I've seen photos of really bad gallbladders, and it scared
with all the
me
stones
to make sure I take care of myself. But it's one of those things that your health is really important. It's every organ in your body could be affected by sepsis.
Exactly.
And then the skin, you think, oh, I have a small cut, a laceration, and you put some Neosporin on it, and you think you're good. But if you're not really watching it and monitoring it, it could lead to sepsis.
It could lead to sepsis, especially if it's a deep puncture wound, maybe from a nail that you stepped on, or maybe your cat scratched you as well. Literally anything can lead to the infection, and if you're not cleaning it and making sure it's healing properly, you can have that infection spread, and then it can become bloodborne as well. So the more it progresses, maybe like up your arm or up your leg, and the worse it can get. So definitely you need to watch for those signs, whether the infection, the redness is climbing up your arm or leg or where have you. If there's pus, if there's pain, that's worse than you're expecting it.
Yeah, so a small wound can lead to sepsis. Just remember that. Making sure that you're following all protocols to make sure you have everything you need to keep the wound clean.
Exactly.
And now we talked about anyone being anyone can get sepsis, but the most vulnerable populations are people with weakened immune systems. So if you're dealing with an issue that causes your immune system to weaken, that is an issue you need to worry about. Children and infants, and then the elderly.
Right. So it's very important when you're around children and infants and your elderly, because they're at our extremes of our ages, right? So either they're too young or too old. The immune system in the too young is not mature enough, and you need to help it. And by helping, you need to have your vaccines in place. You need to have the people around you make sure that the vaccines are up to date. So there's mild infections or infections that are deadly, but we've kind of overcame those infections because of our vaccination. So like measles would be an instance where measles predominantly will cause, the certain symptoms, but in that small group, it can supersede and cause panencephalitis. So it's a very deadly, life-threatening disease that affects the brain. It can cause death in children. So that's one of the things that would be important to keep your vaccine schedule up to date for the children, just because you want to have that protection for everybody as well. And for the elderly too. So you want to make sure you're vaccinated, or if you have the flu, make sure you don't go see grandma, because grandma might not be as adept to be able to fight that infection.
Yeah. Now, when it comes to sepsis in the early stages, is it true that symptoms can mimic other conditions like the flu?
Of course.
So you may think, okay, I'm getting I have a high fever. Okay, I'm just dealing with a flu. And most people, when they have the flu, they try to rest, ride it out, kind of thing. So
yeah. So definitely, you want to do your over-the-counter medications, the flu. What are they like? Tamiflu, exactly.
Whatever it may be.
Yeah, your like flu and sinus infections as well. Your Motrin, your Tylenol to help fight the fevers. But because usually viral illnesses, they have a specific timeline. So if it's within, usually you're exposed, and within the week you can be sick. So then you start having your flu symptoms, right? And then it usually takes about 5 to 7 days for you to recuperate from those flu symptoms. So if it's already past the 7 days and you still feel terrible, if you still have fevers that are just not really being controlled, or you're having trouble breathing, or you can't catch your breath, you're breathing too fast, those are the red flags that we would be looking for, that the infection is progressing into a sepsis.
So we're going to go through the symptoms again, just to remind you. You had them in your presentation, but it's always good to just write them down and remember. So a fast heart rate.
Of course.
Low blood pressure, so that's a telltale sign. Fever or hypothermia, so either really high, high, or really low.
Yeah, so 102 degree or higher. And then so our normal would be 98.7, so anything below 98 would be too low.
Okay.
Yeah.
And then shaking or chills, warm or clammy, sweaty skin.
Of course.
Confusion or disorientation, which I think is one of those where you really need to go seek help right away. Shortness of breath, a sepsis rash, a rash that you talked about that maybe you never noticed before or didn't happen with the infection you had. Now you're starting to see a new rash forming. And then extreme pain or discomfort.
Exactly.
So just making sure you're fully aware of those. Now let's talk about kids and sepsis. So obviously the symptoms would be similar for children, right?
Yes. So the symptoms will be similar, and kids are able to compensate for being sick a little bit more. But as soon as they start decompensating, whether it be they start getting a little too sleepy, or not able to wake them up, or they not very active, or if they're starting to be more lethargic, which is like they just want to, not do anything, they're too fatigued. But once these symptoms start coming out, then those are your red flags. Like they're really not acting normal, because as soon as they stop compensating, children tend to decompensate a lot quicker and into a septic shock.
And the numbers when it comes to children in U.S. hospitals who suffer with severe sepsis is about 75,000, and they results in about 7,000 deaths. So it is not uncommon to hear about sepsis in kids.
Yeah.
And then So what should we be looking out for? So my child's been slightly sick, they maybe have a little bit of a fever. After a certain period, that's when should we say, okay, this may be a little bit more? What are those telltale signs where a parent should definitely go and seek professional help in an ER or an urgent care?
I would say, yeah, the same. So if the fever, if you're trying to control it with a Tylenol and Motrin, never give aspirin to children.
Yes.
So don't do that. Definitely, you can give your Tylenol every 4 to 6 hours, and then you can start your Motrin somewhere between 4 to 6 at the time that you gave the Tylenol, and kind of overlap them to control their fever. Obviously, if the fever's not being controlled and the Motrin and the Tylenol alternating them is not helping, that could be a telltale sign. If the fever is above 102 and it's just like persistently staying there, that could be a sign. If they're just lethargic and not acting themselves, whether you have a baby that's, usually happy, or, a toddler or a school-age child that's like running around doing stuff, even though they're sick, they're still able to do their own independent things, whether it be playing with their blocks or going, getting a snack or what have you, or being able to drink water. If they're not able to do any of the things that they would normally do, and you see them that they're pretty sick, like, better to go get them checked out than to wait.
And now, are premature babies more susceptible to infection and to sepsis?
I would say yes, just because in a premature baby, already a baby doesn't have a mature enough immune system when they are born at a normal term. So like at 38 to 40 weeks, you have your mother's immune response still fighting infections. But if they are born way earlier, before those 38 weeks, then they're preterm. And then with how much preterm they are, their little bodies are not fully developed as a baby who met the term pregnancy. So they're just more prone to having infections, especially if they're around sick people or people who are not up to date with vaccines. So definitely everything increases the chances.
So when it comes to our kids, and you talked about it, I think we've mentioned it a couple of times, but vaccines.
Yes.
Staying up to date with your vaccines and making sure that you're just, every time that seeing your pediatrician or your family medicine physician and making sure that they're
up
getting
to date, yes.
Because
it's all about helping not only the child who's getting the vaccine prevent disease, but also those children that are unable to get vaccinated because of some congenital disorders. There are some children that are not able to receive what we call live attenuated vaccines. So like the varicella would be one of them, and they're not able to get that. So if you have enough people around you who are up to date with all their vaccines, then that person has the less chance, or the child has that less chance of sustaining
herd
that
immunity that
exactly.
we talked about during COVID.
Exactly.
Once we were able to build herd immunity, we were all safer. Now, sepsis and pregnancy. If you are pregnant, are you more at risk for infection and for the potential of sepsis?
You could be more at risk. So during pregnancy, your body changes a lot, and with those changes, it can make you more predisposed to having an infection, or just predisposed to be able to fight the infection. So sometimes pregnancy, the immune system could be just a little bit lower. Your blood pressure is already a little lower, so you're trying to compensate these changes while still being able to help form the baby and help them grow, correct? And it would just make it a little more at risk. So definitely, like if you have a sinus infection and that sinus infection has gone on with months and months and you're not able to fight it, maybe it can progress into a bacterial, like a more bacterial infection that could come down through the postnasal drip into your lungs, and then you start kind of like unraveling a situation.
All right, and then diagnosing sepsis. So obviously they come into the hospital, they're in the ER, and you're basically doing a physical exam, lab tests, x-rays, and other tests. You're even trying to get blood cultures and really trying to pinpoint the infection, right?
So usually when somebody comes in, it's like they're not feeling well, and you can see whether a person is really decompensated enough, and if they have already an established infection that they're getting antibiotics for, like a UTI. A lot of elderly people come in that they're like, oh, I have a UTI, and I'm just not feeling good, like my fever's increased. Or you can have a person from the nursing home who's been treated, or they have a change in mental status as well. Some people get too confused or start getting too aggressive or agitated. So all these little things we have to kind of piece together, and we have to formulate our clinical diagnosis, which is like just by looking at you and putting these little things together, you know, checking our boxes with our search criteria, the Q SOFA or the SOFA, we're able to already think about, well, what if it is sepsis? So then as soon as we are alerted to the possibility, that's when we take our blood samples, we take our chemistry, lab chemistries, and blood cultures. And then we'll start you on antibiotics without getting any of the results for the blood cultures. But because as soon as we think sepsis, we want to throw in all the antibiotics, you know, to try and fight that infection before it gets too worse. And then once you have that, what we call sensitivities from the culture results, then we can dial it back with
the
specific
antibiotic. And I think it's really important because this is a startling statistic. Every hour that you delay treatment of a child with sepsis, it increases their mortality by 8%, their risk of mortality by 8%. So that, I know we always talk about the golden hour, that first hour after a traumatic accident, where
or
you need to
even
make
like a heart attack or a stroke.
Heart attack or stroke. That first hour is always key.
So
past that first hour, you're starting to really see that the risk of death increase. Yeah. Now, when it comes to treating it, obviously, so you talked about you give them the antibiotic at first, and then you are able to drill it down to the proper antibiotic. What other treatments would a patient get with sepsis? Will they have to do anything with oxygen or any other treatments? Of
course. So definitely when you come into the hospital and into the emergency room, we'll take everything. We'll take your vital signs, and depending on whether maybe your blood pressure is too low, we'll start giving you fluids. And if the fluids are not raising your blood pressure adequately, then we'll start medications to help with that. If you have a fever, well, then we'll give you something to break the fever. If you'll start your broad spectrum antibiotics before we get our culture sensitivities. That way we can target what the organism is sensitive to. And then apart from that, like if there's anything else going on, maybe your blood sugar is too high, you can start getting insulin, or what else? So it just depends on the clinical picture of that patient.
What you look like. But it could entail much more than just antibiotics.
Of course. So also goes back to your predisposing, your comorbidities. So if you're diabetic, and if it's out of control, especially with infection causes your blood sugar to go up. So we want to make sure we get that blood sugar controlled. We want to make sure that your heart is doing okay, because the infection can also cause a lot of strain in the heart and can lead to what we call a non-ST segment elevation myocardial infarction. So you can essentially be having a heart attack because of that strain from the infection, which we also now need to treat. Now you need to we have to have the cardiologist on board to make sure that everything is done for that. Or, you know, if it's a pneumonia and it's just progressed so far that now you can't breathe on your own, then we would have to put you on a ventilator just to help the burden of you working and breathing, and then we'll do it for you.
And now when we talk about antibiotics, we're in the Rio Grande Valley, so obviously the border, a lot of people go to Mexico and just buy antibiotics, and I know people buy Z-Packs and different types of medicine. But when you're dealing with an infection, you really need to be seeing a medical professional, getting evaluated so that you're taking the proper antibiotic, right?
Because sometimes you might think you're sick, and it could be, or like, oh, I have phlegm, you know, I'm coughing up a lot, like, oh, it's bacterial, where it could be viral. And then now you're taking antibiotics that you don't need to take, which can lead down to whatever bacteria is in your system or that you come into contact within now is becoming resistant. So now those antibiotics don't work as well. Or even the manufacture of the antibiotics in Mexico might not be as stringent as it is in the US. Maybe the concentration of the antibiotics within those medications that you get might not be fully like 100% throughout the whole dosage. You know, that could be an issue too. Or you might even get where you're buying and paying one thing, and it can just be totally something else.
Yeah.
So definitely, you like for any infection, you have preferred, right? Like to go get medical attention, to see your doctor, to get the test done, and then to like treat those
the proper medication,
exactly
and treat it.
Infection with the proper medication.
And you know how many times you should take it,
Exactly.
how many days,
Yeah.
twice a day, whatever it may
Yeah.
be, but knowing the proper amount that you should be taking.
Exactly. Because sometimes one bacteria or one thing or one fungus may require a different medication, and that medication to have the therapeutic levels in your body requires it to take you like 3 times a day instead of the 2 times a day with a different one. And instead of 5 days, now you have to take it for 10. So it really depends on the type of medication with the infection that you're trying to fight as well, to see how like which medication is good for you and for how long you should take it, and the dosages as well.
And then with the long-term complications of sepsis, so once you recover, you're released from the hospital, you're discharged from the hospital, you could still be dealing with some health issues, right?
Exactly.
There's insomnia, panic attacks, joint and muscle pain, decreased cognitive functioning, organ failure that you may still have to deal with some of those issues. So this is something that is really serious.
Of course, yes. So if you had maybe a UTI that progressed so bad that it went up the ureter into the one specific kidney, or maybe even both kidneys.
Yeah.
Maybe the kidney damage because of that infection, now it's not working. So if it's so bad, maybe you would have to go into temporary dialysis, or maybe you just lose the kidney function altogether if it's progressed so bad that it's not working at all anymore. So it puts more strain on the body and your ability to recuperate or live your life as you would before. So that's why a lot of patients are not, they don't go back to their baseline before they got the infection, before they got sepsis, because it's just took such a toll on the body that the body is not able to recuperate from it.
And you gave some great advice when it came to sepsis prevention. So timely and appropriate treatment of an infection is key. So number one, just making sure you take care of that.
Exactly.
But then you talked a little bit about preventing an infection as well, which I think is also really important. You're obviously managing any chronic conditions, but when you get to just preventing infections, so we're talking about washing our hands.
Yes, washing your hands.
And we talk about this a lot, and I think during COVID, people really realized how important it was. And the happy birthday song, two lines of it, reading the chorus, going through the chorus twice, to washing hands. So just making sure that not yourself, but also if you're a parent, that you're really paying attention, that your kids are also washing their hands.
Yeah, because it's also difficult with children, you know, especially with babies or toddlers. Like everybody likes to put their hands in their mouth. Touching your face also, maybe if you're not outside your home, try not to touch your face, because you might have something like some type of virus, and we're here touching the desk, and now like I'm gonna go and touch my face in the car. Like, no, it's really important to wash your hands whenever you can, or just minimize touching your face, touching your eyes, touching your nose, touching anything that could bring the infection internally, or the bacteria, the pathogen internally. Keeping
cuts and other wounds clean and keeping them covered until healed. And what do we need to make sure that we're maintaining a clean wound and we're allowing it to heal properly?
Well, the best thing would be soap and water. So definitely make sure if you get a cut, make sure you wash it thoroughly with soap and water. You can cover it for the first 12 hours, maybe a day. You don't want to keep it covered too long, because if it stays wet, then that's not a good thing either. We want to make sure it dries and forms a scab. But also if it stays open and you're trying to keep it clean, and sometimes it gets infected and it starts getting red, and then if pus starts coming out, well then maybe the normal Neosporin or topical antibiotics are not helpful. So you want to go get checked out, whether it be with your primary care doctor or with the urgent care or even the ED. Like, it's good to have these wounds, especially when there's redness and pus starting to come out. Maybe you start developing a fever. Now you know that the infection is kind of overwhelming your body.
And lastly, getting medical attention immediately if you suspect an infection. So that's key. We've talked about it. If you don't feel well, if something doesn't feel right, seek medical help. Exactly. So always try and go to your primary care physician first. And sometimes it may be it takes too long, and
maybe they'll give you an appointment 3-4 days out, and between that time and your appointment, you start feeling really sick and really terrible. So just go to the urgent care. Like, definitely don't maybe don't go too fast, but do as much as you can. And if that's not helping and you're not feeling good, then definitely go to the urgent care or emergency department. Exactly.
All right. Well, thank you so much, Dr. Frausto, for joining us. We really appreciate all of the information that you've shared with us today.
Of course. Thank you.
And that officially concludes our webinar. Thank you for joining us. We hope you will continue to prioritize your health and the health of your loved ones. We hope to see you for our next installment of this Let's Talk Your Health series on Tuesday, October 21st from 5:30 to 6:30 p.m. when we discuss lung health. Like and follow the STHS Facebook page for more details on our future Let's Talk webinars. And if you'd like to see our previous seminars, all you have to do is visit sthsletstalk.com. Until our next seminar, stay healthy, stay safe, and please prioritize your health. At South Texas Health System, the health of you and your family has always been our top priority. It inspires us to be among the nation's healthcare leaders. We're proud to be home to the Valley's first and only freestanding children's hospital, the state's first dedicated heart hospital, the first behavioral health facility with private inpatient treatment, and Hidalgo County's first Level 2 trauma center. And we continue to transform healthcare, investing in advanced technologies and innovations to help you heal faster. It's that commitment to your health that has allowed South Texas Health System to build a reputation for excellence across 11 facilities, earning recognition for patient safety, cardiac care, robotic surgery, women's health, stroke care, and more. With our integrated network of nationally recognized facilities, freestanding emergency departments, physician practices, and outpatient centers, we are where you are, providing compassionate care and comprehensive services for you and your family.